Hello. I hope you still have some energy because we have a very exciting topic and I think, really transformational topic today about how AI and generative AI will change healthcare and life sciences, and what a stellar panel I have today. I would like to ask our members of the panel to introduce themselves. Dr. Papadimitriou, may I start from you?
Well, thank you very much. It's a great pleasure to be here with you and Krishna, and I look forward to a very interesting discussion.
Thank you. Krishna, can you introduce yourself, please?
Sure. My name is Krishna Singh. I'm part of AWS Public Sector and Industry team, focused on healthcare, analytics, and ML. I work very closely with our customers, which includes Ministry of Health, health regulators, large academic medical centers, help them on the topics of data analytics.
And to introduce myself, Alexandros Papaspyridis, say it more Greek. I'm the general manager of Nefos Consulting. For the last 15 years, I've been working in Microsoft in the education sector. And right now, I'm an advisor. I'm working with an AWS partner and a Microsoft partner as well on Azure, Flywheel, which is doing medical imaging software. So I'm looking forward to this panel today. I would like to start first with the questions. One of the promises of AI, and particularly now with generative AI, is expanding access and equity. And can you share some examples that you have seen AI projects in healthcare that led to social change or justice, particularly in the underserved communities? Dr. Papadimitriou, can I start with you?
Well, this is a very loaded question, because we have first to decide what is and what are the underserved communities. We have, I think in my mind, we have two, let's say, very wide gap. We have on the one side the communities, let's say, in sub-Saharan Africa, in areas of Southeast Asia, which are underserved because they are less developed, let's say, than other countries. But we have also underserved communities in the developed world. In Greece, for example, we have communities like the Roma, the immigrant communities, communities of people who have fallen outside or beneath the social network. So they represent two different groups, and each one of them has its own problems. So I think the big question is what to do with these people, whether they will find any help from AI. Not directly is my answer. Indirectly, they will. If people are geographically challenged because they are in areas which are difficult to access, then definitely yes. And we do have such an example. You may be interested. We have a fleet of ships, and these ships are geographically challenged because they are in the high seas, and they will need occasionally, not too often, thank God, but they may occasionally need assistance. In this case, AI might be very helpful. We can have a system which is on board or even onshore, but communicating digitally via satellite to assist the captain to provide, or an officer to provide first aid health to the ship. The other thing, and I'm going to close because I don't want to take too much of your time. Sorry about that. The other thing is that there is a similar issue. Do you know which area of the world has the highest e-banking penetration? E-banking, phone banking.
Kenya.
Sub-Saharan Africa. So this is a prime example of an area which is underdeveloped, but leapfrogged to the forefront of technology. The same can apply here.
That's a very interesting paradigm to follow. Yeah, how they managed to do with fintech. Krishna, what's your view on that?
I'm going to give you two examples. One comes from the life sciences, and the other comes from the healthcare side. So life sciences, and this is publicly available, Pfizer. So Pfizer, when they announced that with BioNTech, they are going to, develop the COVID-19 drug, it took them end-to-end 269 days. And normally, for a drug research to coming to FDA 3B stage, it takes 8 to 9 years. And I would like all of you to go and look at this example, a reinvent talk by Pfizer CIO. She has mentioned in there that what it took from an AI infrastructure perspective, that how AWS helped us. And we all know that how it touched our life. So 269 days, what used to take 8 to 9 years, or 9 to 10 years. So that's life sciences. From a healthcare side, I'll give you an example of a company where I personally was involved. And it's a Dutch international company. It's a healthcare platform which brings patient, provider, insurance on the same platform. Super interesting because it's a very unique ecosystem. Patients, provider, and payers. They operate in Kenya, Tanzania, and Nigeria. And they have approximately 8.9 million patients on the platform. And the key help they got from AI ML was, how are the doctors writing? Why are the doctors writing a expensive medicine when a generic pharma at a lower cost would do the same job? Same formulary in those drugs. One is a branded, which is expensive. The other one is generic, that means it's a very lower cost. Why are the doctors writing one, not the other? Right? So these are two examples which I would, both life sciences and healthcare, which I think was very, very tangible from AI.
Can you clarify where is the customers on that? Which part of the world?
Yeah, so the healthcare examples which I mentioned, it comes from Kenya, Nigeria, and Tanzania, three countries. They're expanding now in the other developing countries and underdeveloped countries, but the time, and this is 6 years back now, Kenya, Tanzania, and Nigeria.
But actually, we can search it and that. We can do that. The same thing here in Greece, as well as in the United States. There is this question of controlling the cost of healthcare. Social security costs are expanding exponentially throughout the world. The United States is one of the areas of countries in the world that spends most per capita for healthcare, while providing a service which, by general acceptance in my own experience, is not so good. So using all these tools of technology, and particularly AI that can tailor the specific, as you mentioned, drug to the specific patient and monitor the cost and monitor the doctors who compensate for the risk factors by over-diagnosing or over all this stuff. So they can cut costs. And this cost cutting can be very helpful to the society in general. It can provide additional funding for other people who are, as I said, below the social security net. And we are doing this here in Athens at the Onassis Hospital. We don't yet apply AI yet, but it's not available. But we are using digital tools to control, and have Mr. Panos Minogiannis here, Antwell and other people, Kostas Petsis here. We have the tools to better control the costs. And another tool which is also very useful is the better management of the time of the doctors. You can tailor the patient to come in at a specific time, whether it is to have an operation or a diagnosis or imaging, technology, or whatever. So the access to these tools can be more efficiently managed by using all the digital tools, and eventually AI is a tool that can be very useful to assist in that.
And there's a hospital in Israel which is now using generative AI to triage their patients so they can free people time, which is a great question. But yes, US, the life expectancy is falling, so it definitely can do with some of this. It's not only the underdeveloped.
Yes, it's not only the underdeveloped countries.
The companies. Shifting a little bit to life sciences, Krishna, I would like to focus here. Here in Greece also we have one of the startups, Intelligentsia, using machine learning to reduce the risk of clinical development. And last year we have seen a notable rise in novel active substances. I read an article by Himanshu, your colleague Himanshu, posted a couple of days ago. How do you see AI and machine learning contributing to this surge for these novel medicines. I think you also hinted to that in your example about Pfizer. Can you take us through that?
Yeah, no, absolutely. So if I have to mention it in one sentence, what's the impact of it? It's a faster time to market for a drug with the maximum efficacy. That's what the whole idea of new molecular and the substance discovery is. Now, the key part here is how do we bring the cost down, because there goes a lot in terms of computational research, which is involved in bringing these drugs. So if you look at it from the life sciences perspective, they invest quite a bit on this. So they would like to make it cost efficient, and they would like to make it faster time to delivery, right? That's the key part of it. There is also a different lens which you can take, especially from the new drug discovery perspective, is the regulatory part, right? And I will give an example of rare disease. And again, just for this audience to define what is a rare disease, if just 5 people in 10,000 have a particular disease, that's categorized as a rare disease. And there is a huge challenge of drug availability for rare disease. Think about from a life sciences companies, they invest a lot in a pharma, in a drug. And if it's reaching only for 5, why would they should invest? So this is where the health regulators have special incentives. They want these organizations to bring the drugs. And AI/ML is playing a very critical role on this, especially bringing the cost down. And I will go back to the example which Minister yesterday gave when he was giving his demo. They did mention that the cost of running these LLM models, which are very much key to the research now, is massive. Think about, if you're really thinking about return on investment, ROI, right? Just for the 5 patients out of 10,000, if I need to have a new drug in the market, I do want to be more experimenting and more cost efficient. So I see that GenAI has a lot to do in that space, especially from the new drug discovery and molecules perspective.
Yes, absolutely. And we do have a Greek company that does exactly that. It's between us and between, in fact, Yanina and Lausanne. They do exactly what you described. And it's one of the best companies we have invested in this company. That's why I know about it. It's doing exactly what it's actual. It's not in the future. Absolutely. It's not science fiction. It's now happening.
Indeed. And again, AI/ML, and especially GenAI perspective, and I'm happy to talk more about it from more research perspective, has a lot to offer from this perspective. I will give another example of, again, since it's a GenAI Summit, let me talk about something called a health agent. And the audience which is technical here, they already know what is LLM agents. Agents are basically a way to do everything else than what LLM models do not do, right? Let's accept it. Models are there to summarize whatever, text to text, text to image, text to video, but there are other things which is needed for a large language model to work. Health agents does exactly the same. Now think it from healthcare perspective. Your EHR data resides in EHR system, your patient record. Your medical imaging data resides in PACS systems. Your genomic data resides in, let's say, a omics store. If I want to have some prescriptive information about a patient, a LLM model should have mechanisms to go and fetch the information, summarize it, and give it relevant information to the healthcare practitioner. So this is one of the things which, from AWS perspective, we have been working, called Health Agent, and which does exactly that. Multi-model data and ability to bring and summarize the information, and in a way that a healthcare practitioner can understand. That exactly it brings.
And this is very interesting because you are bringing together these different sources. You know, it's not only personalized medicine, but it's the delivery at the point of care. This is very interesting, and really including these rare diseases, which include in sub-Saharan Africa the neglected tropical diseases, a way that we expand equity in a pragmatic way. In light of this, I would like just to take this conversation. What does it mean for a country like Greece? Where do you see the low-hanging fruit for the use of AI in healthcare and life sciences for Greece? Where should we start on that? Dr. Papadimitriou, you also have the privilege that you have built Onassis, a jewel in the Greek healthcare system. So I would like your perspective, both from that as well as the broader foundation.
Well, believe it or not, we are, because some people may think that we are a very conservative foundation, but we are one of the very early adopters. We had, back about 40 years ago, we had an IBM mainframe computer for the accounting function of our shipping division, and that was established in Monte Carlo, actually. We were one of the first users of a mainframe IBM. You can imagine, a dinosaur. Yeah. It had a large room just by itself, but it was working properly. But now, today, we are very keen on all these subjects. We have, of course, in our public benefit function, we have a section who is dedicated to AI, virtual reality, augmented reality in arts. And it's a very successful thing. It is doing fantastic things. It's between Athens and New York, and people actively ask us. It's one of the state of the arts, one of the best in the United States, one of the 7 best AI for art labs in the United States. And now we're bringing it we built it in New York because this is where the technology exists, and now we are transplanting it in Greece. So Greece has an absolute advantage here because Greece starts from zero. It's like sub-Saharan Africa in this sense. So we start from zero, but everybody else also starts from zero. So we are at the same level, and we have a fantastic network of people, of scientists who are working there, and these scientists are nimble, they are entrepreneurial, they are open-minded, they are academic, and they have access to capital. So we start at the same level as everybody else, and we have actively pursued, as the Onassis Foundation, we have actively pursued these things, and as I mentioned before, we have invested there. So the low-hanging fruits is our people, and I think the present government is very willing and keen to assist and provide grants and facilitate this trend.
So you're saying that now AI is the great equalizer. This is the big opportunity.
Yes, everybody starts from the same level because everybody starts from zero. Yeah. And it's open source. It's the beauty of all this digital technology is that it's available. You don't need to be in New York or in Los Angeles or anywhere or in London or whatever, to MIT or whatever to get it. You can get it from your home or from our office or from your campus in Woudi in Athens.
Yeah. Krishna, but also you have seen many countries, many leading pharma companies which are using AWS. What do you see? What should Greece do?
I'll give you 2 examples, but before that, just to answer and kind of carry forward your thought, we see cloud technologies also as a great equalizer. Whether you're a Pfizer or a small pharma company based in Greece, you have same access to the tools which we provide. So it's really on your intellectual capability team, how you can and what you can build. Right? So the possibilities are endless. And I will give you one example of this. I come from a country where brain drain is a huge, huge subject, India, right? So I don't have to mention it to it. I also know that that might be an issue here, especially the educated, good experts moving outside the country. Healthcare perspective, you're talking about healthcare practitioners, GP, physicians, surgeons. It's super important how we can augment them, how we can give them the tool so that they can do their job quicker and faster. Giving you an example, we have something called Health Scribe. Health Scribe is ambient listening. That means it uses voice to text and then uses LLM to summarize it, so that the healthcare practitioner doesn't do a color kill job, because that color kill job leads to the burnout in healthcare practitioner. whether it's a GP, whether it's an assistant, whether it's a nurse. They do a lot of these clerical jobs. And if there is a device which can do their job with a trust built, with a security built, and if they can help, think about the impact it can bring. So that's one of the examples. Again, more augmenting, helping the healthcare practitioner do their job better. And that's something which I think is, I will categorize this as a low-hanging fruit, right? Because you just need to tailor to a certain language, and it will be available ubiquitously.
So it's really, and I love this point because there's a lot of fear that it will replace people, and you're putting the focus squarely about how we augment people. It's not about freeing the time from administrative.
It's not true. We have at the Onassis Hospital, I'm taking from my family inside information now. We are using these systems already. We just started using this text-to-speech, which means that the doctor will look at the imaging, whatever is it, and do the diagnosis. He will speak to his computer. The computer will write it down. The doctor will just check that there are no mistakes. And the system learns how the doctor is speaking and will autocorrect after a few times. And then that text can be sent, eventually will be sent automatically to the patient on his email. So that saves at least 3 days of waiting time.
Absolutely.
At least 3 days, maybe more. Because originally, what the doctor would dictate, the secretary would type, the typist would bring it back, the doctor would correct it, send it back to the typist would do the corrections, they go back to the doctor would sign, the doctor will send it to the protocol will send it to the mailing, and the mailing will give it, so forget it. Now it's all automatic. It's not AI. This is not AI.
Yeah.
This is very low level, in my opinion, it's very low level technology, but we are using it. So to come to your question, did our people fear losing their job? Originally, yes, but the doctors realized it's a more efficient way to work. It releases them from a tedious core, and they can do their real job. The secretaries can be used, the typists can be used to do something more useful, like, for example, taking care of patients, arranging for meetings, appointments, etc., which is more interesting than just typing.
Yep.
But everybody's happy. Nobody lost his job.
Yep.
Nobody lost his job. So once they understand it, then they're happy.
This is a great point, and we just concluded a panel earlier, and it was the same point, is when people understand that it will help them, it removes the fear.
There is a fear. At the beginning, there is a fear. There is the same fear with the doctors. We have what we call assistive diagnosis. So there is a tool where which is very useful, by the way, and for me, more trustworthy. So you have an MRI scan, which is, so the patient MRI scan, CT scan, whatever, all that can be 1 terabyte, just one patient. And you have one doctor who is overworked, tired at the end of his day, looking at images. I don't trust that.
Yeah.
But I do trust a machine to look at everything and tell to the doctor, well, you should look at page 125. And there is a finding that leads to a diagnosis of XYZ. That is very helpful. And it's available, and we start using this now already in Greece. That's
Great insights, which exactly leads me to the next question, because what we have here unique is is the different perspectives on that. So we have the Onassis Foundation, for example. Let's look a little bit about all the actors and how the actors should partner. We have foundations, academia, private sector, cloud providers. How this collaboration should evolve in order to maximize the benefits of generative AI in life sciences and healthcare? Krishna, would you like to start?
Sure, I'm happy to share my thoughts. So there are things which technology can do, and there are things which technology cannot. And this is where the policy making comes into picture. I'll give an example of EHDS, European Health Data Space. It's a legislation which focuses on kind of learnings from pandemic. And it has two use cases, primary and secondary. Primary is basically interoperability, secondary is more on research. And this is the point which you mentioned. It's very important that the large academic medical center, hospitals, research institutions, they work together to be much better prepared for next pandemic, right? And European agencies are focusing on that. So EHDS is an initiative and the legislation, which is very promising. It's up to the 27 member states how they implement it, and there are discussions on the way. But this is where the policy making and the initiatives such as EHDS comes into the play. Tools availability is there. I don't think that it's a challenge of the tools and technology. I think it's more policy making, and the governments and EU agencies ensuring that this happens. That's my view.
Yeah. Perfect. And Dr. Papadimitriou, again, you have the you have the two hats, the foundation as well as a hospital, leading hospital. How do you see? What do you need in order? What is the call to action to academia and to industry in order to maximize the benefits for you?
Well, I think there is no need to call for action because they are very much aware. I mean, we have, there is a fund actually, a seed fund or venture capital fund, which is now being promoted with a lot of academics. And what they are doing, and that's, again, it's a very Greek thing, but it happens also elsewhere in Europe and the United States, in India, certainly very much in India. I'm aware of that because we are invested also in your country in this area. Very interesting. So what happens is this, that you have the academics, and they are not just, they don't just come from research, medical research. They also come, interestingly, from the economic university. They team together, and they found somebody who is a venture capitalist, who organizes the fund, and then they come to us and other people to put in the money. So this cooperation already exists. Mm-hmm. In the absence of the state, we don't need the state, particularly the Greek state. It happens elsewhere without the assistance of the state. Now, it happens that the minister, Kyriakos Fiarakakis, is very keen on, although he's now Minister of Education, but he's very keen, Minister of Health is also very keen. Everybody's very keen to do that, but it's already happening. It's not one fund. So the area where this actually happens is this. Medical faculties, economic faculty, entrepreneurs, businessmen, investors. They work together. It's happening. And it's a great challenge for our country and for Europe and for India, for the rest of the world. And I think as we move ahead, if I may say so, as we move ahead into an environment, a social environment where we have more people getting older. And that has many different repercussions. One of them is that these people lose productivity. So in order to have growth in an environment where we have stable population not growing in numbers, but growing older in age, you need a productivity improvement. And this productivity improvement can happen through what we are discussing here today. This is the next big challenge, alongside with the challenge of climate change, which is also the other. I think it's not the subject of today. So this digital revolution will create the productivity that will allow the economy of Europe, the United States, the world in general, to move into feeding all these hopeful retirees, I would call them.
I love this focus that you put on the entrepreneurship element and bringing together both the medical researchers as well as the faculty from universities in order to be able to bring them all together. So it's really creating this accelerator that will help bring the innovation to practice and working on that. I'd like to switch gears, and you hinted about the global health crisis. How do you see AI now to help us to prevent, or if not prevent, respond effectively to the next big pandemic or crisis that we will have? How do you see this? What are the key focus that we should put on that?
Well, I'm going to talk about something slightly different.
Sure.
So what I'm going to answer you in a slightly different way. I think the main issue here is cost cutting. Is the use of AI to cut the cost of everything, from the research, from patenting medicine, from proving the effectiveness of a drug, but down to a very down-to-earth element, which is that we have, as I said before, a population that grows in age, therefore will need more medical care. That means more demands on the budget of the state, and that can be better managed through AI, because AI can, first of all, the easy stuff, okay, low-hanging fruits, data processing, big data. You have millions of retirees having millions of diseases and millions of needs in healthcare, and costing literally trillion of euros and dollars. So AI can assist the state to better manage this process, to cut the cost, better manage healthcare. I think that is, for me, that's a very big thing. I'm not qualified to talk about the first part of it. I'll leave it to you, Krishna.
Happy to share my thoughts. And
Yeah, Krishna particularly, this is a great point that Dr. Papadimitriou is doing here. And I would like to ask about what does it mean in order for this to be a reality? The data state, do we have the data? What should the government do about, having the right data so we can address this cost effectiveness?
Yeah. When it comes to the cost part of it, I mean, it depends how you look at it. Again, life sciences or healthcare perspective, both equally. So I'll give an example of healthcare overall. As you mentioned, that cost is super important. Cost of care for the affordability, quality of care, super important. It's not going to get easy because of the aging population. And if there is anything, if you can see a pattern, Europe follows the pattern of Japan. So things which happens in Japan from aging population perspective, you can see that moving towards Europe. A lot of factors, fertility, mortality, aging population. We are living better. We have much better access to the technologies. We need a different kind of tools to handle this. And this is where GenAI AI has a promise of doing this. Again, a couple of examples. Remote patient monitoring. That means keeping patient at home, because let's accept it, we probably know, but 60-70% of cases, patients do not need to come to a healthcare practice or facility, right? This is where computer vision comes to play. This is where large language model, and again, the ecosystem and tools which comes into the play. So, and these are all about the cost. It makes a difference.
Very great. I think the focus on cost efficiency, aging population, which accelerates this need, and a fantastic example on remote patient monitoring as a way to alleviate. I want to leave some time for questions. So, let's wrap it up a little bit. What should we expect? How do we look in the next couple of years? What is the call to action? Dr. Papadimitriou said, hey, we are taking the future in our hands. We are putting money. We are promoting entrepreneurship. Dr. Papadimitriou, what's your plans for the next 2 years? What do you see happening?
Well, as I said, we are very focused on this in many different aspects. One of them is, as I mentioned before, in art, and that's a very, very active sector, And Europe has, as I said, an advantage because it has the mental capacity. So does India, by the way, and China. We should not forget that China is a huge country. It has a very aging population. It has a big problem coming, a demographic problem coming up, but it has also very high-powered intellectuals there. So that's art is one area. We are in shipping. Again, AI is a very important part of our future plans because with AI, you can use your ships more efficiently and more safely. You can plan, to give you a very simple example, planning the route of a ship that goes from, let's say, from Europe to China. It's a 60-day trip. You can plan your trip better if you know the weather, better, the waves, etc., and your ship. AI is very helpful in this respect. And we have built in our ships, we have it's unbelievable. We have about 400 sensors on each ship. So we know real time, and that all communicates via satellite. So we have real time data on each ship. What's the speed, what's the consumption, each engine, what is the pressure, what is the temperature, so each cylinder in each engine. So shipping is an area we're looking very much to implement this, and we have already started, of course. The other is the hospital. I mentioned the hospital. We are very keen to have our doctors use assistive diagnosis more and use all the other tools that AI can provide us. And the other thing, the last thing which we are doing, here we have Stella here, and I think our scholarships. All our scholarships have changed now, and we're giving 110, 120 scholarships a year. So they are given only for disruption and innovation. Not only do you have to get a scholarship to have one of the best in your university, but also you have to prove that you are doing something that will be innovative and disruptive.
Fascinating. Also, I think these are great segues. I would like to Yorgos to take note of the two important topics that Dr. Papadimitriou mentioned here is, art and shipping. We should cover it on the next summit, Yorgos.
There is a Greek company, there are several Greek companies actually that are specializing in using AI for ships.
Fantastic. Krishna, what's the next 2 years? What should we expect?
We are super excited, especially with the development of GenAI. Again, just to share with you, our healthcare and life sciences customers, many of them, they have already been using AI/ML, so from long time. So from our perspective, we are a cloud technology provider. We really take a lot of pride and excitement in giving the building blocks which customer can use. So, and again, to give you an example, if you are a health regulatory body, and I would highly recommend that you look at EMEA AI work plan for the next 4 years. They focus quite a lot on experimentation and collaboration. And if you do want to experiment and collaborate on the GenAI, cost is a huge factor. And this is where we have a 3-stack offering, which we call the bottom layer is more for GPU or foundation model developers. Middle layer is where you can experiment cheaply. You can experiment with the model of your choice, and you can build something quickly, experiment, see what is right for you. And then there is a top layer, which is the application layer, which you don't have to do anything as long as you know LLM solved my problem, and this is the application to use. You can directly integrate it in your application. So from our perspective, we take a great pride in giving these building blocks to the life sciences, healthcare, Ministry of Health, regulatory bodies, so that we help them build things which matters and creates impact.
Fascinating. Okay, we have time for a couple of questions from the audience.
Hi, everyone. I am Dimitris from Kozali. We're working on a very similar domain. I'd like to ask a question to Krishna. Specifically for one of the main topics of this discussion, drug discovery, I'd like to ask about the preparedness of the LLM ecosystem when it comes to helping big pharma companies to adopt LLMs, and specifically on 2 pillars, accountability of the answers and privacy. And why I say these 2 pillars, accountability, because usually early stage drug discovery starts from extracting insights from evidence, literature. So if you get a hallucinated answer from an LLM, that would lead to perhaps even 10 years of clinical trials to waste. So accountability is very important, and you can't afford to make mistakes here. And privacy, because if I am going to be an early stage researcher and I ask something to an LLM, which is a third-party API, I wouldn't feel very confident from a competitive intelligence standpoint to share these insights, because maybe I don't trust that this is going to remain secret and it's my intellectual property. So I'd like to ask, when it comes to accountability and privacy, what are the safeguards that big vendors like you have to offer that will, let's say, ensure and will increase the trust of big pharma companies to start adopting these LLM technologies more quickly and more efficiently?
Excellent question. And again, in AWS, we have a saying that there is no compression algorithm for experience. And this is where we take great pride in ensuring these two points which you mentioned, which is super important. Because as a life sciences organization, you can be super enthusiastic in bringing something to the production. But if it has concerns such as this, it will be creating more harm than benefit, right? So we literally have a service called Bedrock feature guardrails, which handles a lot of these things. Because we do think so security privacy is job zero for us. We start from there. Because think about it, if I do not have trust in the AI model or GenAI LLM model, everything is waste. So ensuring that you have a trust through the data, through the model, and this is where the experimentation comes. This is where the guardrail comes. This is where how do you ensure that your data belongs to you, it's not going somewhere else. And these are the basics of cloud technologies which we have been doing from last 20 years. So again, to give you an answer, each of these points are handled through specific services, features, which we provided to our life sciences customers. If they are ignoring it, we highlight it that, hey, you should be aware of it. And this is how at least we are advocating and working with our both life sciences as well as health regulators, right? Because whatever you mentioned applies to the health regulators as well.
My name is Anna Stefanidou. I'm the head of digital education at Athens College. To end with a little bit of a funny note, but a serious question. I remember when the DNA tests came out, where you can send your saliva and see if you have genes in danger or whatever. And everybody was afraid that at some point insurance companies will get their hands on that information and they will not insure people, etc., etc. So now we're talking about LLMs and databases, and we give. I'll say okay to my doctor and upload my information somewhere so that the bot can talk to him, and then I'll say okay to something else, and I'll upload my the receipts to doctors that I've paid, and then how can we ensure that in all these thunderstorm of AI coming upon us, how can we ensure that at some point all of these databases will not connect and a person could type my name and figure out where I've been, how much at risk I am of doing something, etc., etc. Can you predict that, or it's a little bit foggy?
It's already happened, actually. What you said is not in the future.
But is it?
I don't know what to say, Krishna. I think it's impossible.
Is possible or impossible?
It is not possible to stop it happening. It's already happened.
Yeah, I mean, there are a few. So just to give you examples of what you mentioned, it's perfectly okay to have that view. What is more important is once you know how these technologies work, so there is a fear of unknown, right? We don't know what we don't know, but if you do not know what you don't know, you'll always create a dark picture of it. So my recommendation would be look at what is under the hood, how these technologies work. Because the moment you have understanding that how it works, a lot of fear will go away. Now, I'm not saying that there is no possibility exists where things can go wrong. It can. But at least you'll have a clarity that how LLM works, how embedding works, how vector works, what is vector DB, how does cloud provides these building blocks, and is there any possibility of having such a thing which you mentioned? Because knowing will and awareness and education, especially from LLM perspective and the data multimodalities of health data, because that's what you touched upon, right? Will clear a lot of these things for you.
Thank you. With that, I would like to thank you all for staying late, and I would like first and foremost to thank our panelists, Dr. Papadimitriou. Thank you very much for joining us. Krishna, thank you for coming to Greece, for joining us. And to the panelists, we look forward to seeing you tomorrow.